Today we're going to talk about facial masculinization surgery. So what is facial masculinization surgery? Well, it's not one surgery, it's a series of surgery that are often combined with the goal of making a man's face look stronger, more defined, enhance certain features. Now, obviously, every guy is different, and so what each guy wants or needs to look more masculine is going to vary person to person. Today, I'd just like to give you an overview of some of the procedures that I perform and that are available for facial masculinization. Without a doubt, the most popular surgery I perform in men is jaw implants. Jaw implants are designed to give more width, more height, make the jaw square off, and just look stronger, sharper, and more defined. So above is an example of a custom jaw and chin implant. Jaw implants can also be bought just off the shelf as they are, and the goal is really to add width and definition. For the chin, a chin implant can be used if the patient wants to change the shape of their chin and make it more square. Implant is the best solution. For patients who like the shape of their chin but just want it to be stronger, more projected, genioplasty is a great option. And this is where I actually cut the bone, slide it forward, and hold it with two little plates so the chin sits more proud, more projected, stronger, and more masculine. Probably the second most common thing that I do is brow bone implants. Now, brow bone implants are only available as a custom implant. So that means that the brow bone implant is made specifically for you, for your skeleton, and it can also be as projected, as dramatic, or as subtle as you want. So here's an example of a custom brow bone implant. This is a pretty dramatic one where the patient wanted a lot more projection in the brow bone and orbital rim areas, but it really can be however each patient wants. Another option is cheek implants to give the cheekbones stronger, more defined look. The case above is a patient getting custom chin and jaw and custom cheek implants, but both cheek implants, jaw implants, and chin implants come in standard shapes and sizes, so you don't have to get a custom if you don't necessarily need it. And then something I often recommend if patients are trying to get that really chiseled, defined look is to take the buccal fat out. And that's a fat pad that sits right here, kind of between in the cheek, between the cheekbone and the jawbone. And that can help create a little more shadow and more definition in the lower face. There are also options for a masculinizing rhinoplasty where I use a little piece of cartilage to help actually build up the bridge of the nose and to make it just look a little stronger and more projected. So those are your options, and like I said, in a consultation with each patient, we go over what bothers each person, what they would like to change, and what the best plan to get them the results that they want.